Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is the 5 things that you should ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed every year in the U.S. Unfortunately, half overall will not obtain the desired outcome. 10% will actually end up worse than they were before the surgery. So the first consideration is whether or not you should seek a second opinion. A second set of eyes may be indicated since it is a big decision of undergoing low back surgery. That person may recommend that you have the same surgery, in which case, you have another opinion that says go for it. It might be that they recommend a different surgery, okay? Or maybe they recommend no surgery. So it can never hurt to get a second set of eyes. Second consideration is, have you really tried all conservative options first? Most low back surgeries are elective. They're quality of life procedures, okay? So you should really look at trying physical therapy, chiropractic treatment, spinal decompression therapy may be indicated, acupuncture, possibly some medications, whether they're prescription or over-the-counter, and then interventional treatments, such as you see here, which is a radiofrequency ablation treatment, which is great for arthritis of the spine. You can do multiple levels, and that can give you pain relief for 6 months up to 24 months. The third consideration is, have you really done a risk-benefit assessment prior to surgery? No spine surgery is risk-free, okay? Adult scoliosis procedures, for instance, have over a 50% complication rate. Complications may range anywhere from infection, bleeding, nerve injury, risk of anesthesia. Your spine may not fuse if you're having a fusion procedure, and possibly scar tissue can envelop nerve roots after surgery and cause considerable long-term pain. The fourth consideration is to do a reality check on your potential outcomes. Most back surgeries are not a home run. 50% of back surgeries do not end up with the expected outcome, and 10% will end up worse than they were before. So here's one thing to think about. Let's say half of your pain goes away. Is that good enough? Let's look at the FDA study on the lumbar artificial disc. This was completed back in 2003 and 2004. And what they did was they compared the artificial disc, and here's a model with one in it, to fusion for low back pain, okay? And what they found is that, yes, the artificial disc was equivalent to outcomes with fusion, but both groups, over half the patients were still on narcotics after 1 year, post-surgery. So even with what's called the, quote, gold standard, there was still a lot of people on pain medications afterwards. So what that means is that most of these are not a home run. The fifth consideration is, if you're going to undergo the procedure, consider the timing. If it's an elective procedure, you can pick the best time, whether it's a summer break or a sabbatical or whatnot. The rehab considerations for a laminectomy, you're looking at 6 to 8 weeks. For a spinal fusion, 3 months. And for adult scoliosis, anywhere from 6 to 9 to 12 months. So keep that in mind because, half the battle is the rehab, okay? The bottom line is the objective is to feel comfortable with the decision for spine surgery, even if the surgery does not produce the desired outcome. You want to be able to look at yourself in the mirror and say, I tried everything else and it wasn't working, so this was the right thing for me at the time. It's reasonable to work through these 5 considerations to make sure that back surgery is the right thing for you. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning physicians. For the top treatment in Austin, visit us online today at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.